Okay. Good morning, Honorable Chair, Honorable Members of Parliament, and Honorable colleagues. My name is Harsha Samaru. I'm the current President of the Public Health Association of South Africa, and I'm joined today by Dr. Owen Friedman. He's a very senior member of our organization. He's actually been a member since the organization's inception in the year 2000, and I'm quite grateful to have him with us today to share the submission of our organization with you. So
you can continue. You can continue, ma'am. Thanks.
Thank you, Chair. So just to give you a bit of background of our organization, the Public Health Association of South Africa is a registered Section 21 not-for-profit organization. We are referred to by the acronym PHASA, and we represent the broad public health community in South Africa. Our membership includes a diverse range of public health practitioners, including doctors, nurses, allied healthcare professionals, academics, researchers, as well as civil society activists. So our vision is to provide leadership and a collective voice to improve health. And we want to do this via knowledge sharing, capacity building, partnerships, and advocacy. And we are committed to promoting health and health equity. And thus we are very keen to be involved and engaged with the discussions and deliberations as the country moves towards a national health insurance system. So Dr. Friedman and I will be doing the presentation together. I will do the first half and he will do the second half. And we've chosen to refer directly to our submission today. And the reason we want to do this is we feel that this is the best way to make the information most accessible to the members of the committee. And we feel that this is important because we feel that you will find that a lot of the points raised are distinct and also very relevant to your deliberations. So I do hope that you have a copy at hand. This slide just gives an overview or a roadmap to the submission as we will discuss it. So with that, I'm going to go directly to the submission. And at the outset, I think it's very important for us to state that we welcome the release of the National Health Insurance Bill. And we thank the National Department of Health as well as the Parliamentary Portfolio Committee on Health for the opportunity to comment on it. We are also committed to working alongside the department in advocating for, formulating, and implementing health systems reforms in line with the principles of quality healthcare and universal health coverage. So thank you, honorable colleagues, for the questions. I think we'll try to take them in the order that you've asked them. So I think Honorable Sakacha, you asked what should be removed. I think in certain places we felt that there might be room for minor amendments just to enable the incremental process. Where new structures are proposed that have not been tested in our context, we felt that putting this in the bill and legislating this at this point in time is really restricting the options, especially for untested interventions. So we felt that leaving this out at this point in time might allow for a more robust approach to deciding what is the most appropriate structure of the health system going forward. So it might well be that what is proposed in the bill, when tested, might be the best structure or the best answer for our population. But without actually understanding it and putting it in the bill now, if it's not found to be the most effective means to provide population cover under the single payer system, then we do stand the risk that we will be mandated by the legislative process to continue with this, even if it's not found to be the most reasonable approach for us. Yeah, and then just to say, yes, we certainly support the principle of NHI and look forward to the progressive realization of universal health coverage. And when we say progressive, we don't mean that it should take the longest time possible, but it needs to take the required time. We feel that hopefully it will be a quick process, but given the current context, we need to plan, I think, a bit more pragmatically if we consider the green paper on the NHI that was introduced a few years ago, I think there were timelines articulated, and within the first 5 years, which would have been 2012 to 2017, we had hoped to address all the quality issues in the healthcare system. But according to the Office of Health Standards Compliance, we haven't managed to achieve that even many years after 2017. So I just think that we need to be more pragmatic in terms of the timelines that are associated with the bill. And so maybe leaving these things out of the legislative documents might give us more flexibility in this regard. Going on to the question by Honorable Manai, I think, yes, so sure, I think it has been well proven that the fee-for-service structure does drive up healthcare costs. And so we certainly support the introduction of a single payer system. I think our only concerns is how it's being introduced and the service delivery platform that is being aligned with this funding process. And in terms of, will it actually work straight away? And here again, I'll refer back to the Constitution and the progressive realization of our healthcare goals. And I think we should be cognizant of that as well. I think in terms of, I think I'll hand over to Owen. The next part from Honorable Manai was addressed to you.
I'm not going to attempt to link this to particular individuals because sometimes similar questions were asked. Yes. The question was about the CEO exercising oversight over themselves, and clearly we do not believe in a CEO exercising oversight. We believe in very strong governance mechanisms, and that's why we're advocating that the strongest possible accountability to Parliament be the situation. And the reason we believe this is because with the pooling of funds, if anything was to go wrong with the functioning of the NHI, it would have very, very severe consequences for everybody in society, particularly the vulnerable. And therefore, we cannot afford to have a state-controlled entity such as the NHI failing under any conditions, because that would be a disaster for our health. So we believe in the strongest possible oversight mechanism, and we've actually suggested Parliament. Do we support the bill? Yes, we strongly support the bill and its progressive realization as provided for in the Constitution. Should the service depend on the need or ability to pay? Definitely, the ability to pay should not be a factor, that all people in the country should get the services that they need, irrespective of whether they can pay or not. If they can pay, though, they should pay. And we do support the idea that the wealthy would make a much bigger contribution to the total healthcare system. So hence we support the idea of progressive taxation and possibly, if necessary, surcharges in the form of some kind of medical surcharge, which would be paid by people of high earning capacity. We recognize that there is a differential between the public and private health sector wages, and that our services need to be available equitably for everyone. Is the NHI neoliberal? Definitely it's not. The principle of the NHI is a progressive idea, and that's why, for me, it's puzzling why we would start to use commercial language. If this is not a neoliberal idea, why do we emphasize national health insurance and not universal health coverage? Because surely universal health coverage implies that everybody gets health according to their need, and it has nothing to do with the finance. Well, I should say that the people's ability to pay has absolutely nothing to do with whether they get care. We have emphasized the incremental basis. This is a cautious approach because we want this to succeed and not to fail, and we can only succeed if we build capacity, and we do this in a steady way, in a developmental way, in the way that the Constitution makes provide for. And we think that although there is a phased approach already, it's not sufficiently phased, and we need to be even more cautious than the phased approach. And I think that I would encourage all members to look at the detail. We can't answer the detail in an oral presentation. There's a lot more detail, and obviously, if you want further detail, we'd be happy to make further submissions to provide evidence for what we said. It is a long time since we've made our submission, and a lot has changed since then. Thank you, Chair. That's I think. Sorry, there was the question about the medico-legal litigation. Yes, I think there has been some progress to avoiding this, but I think that progressive countries have shown that it's important to put legislation in place that will help to limit litigation by making a no-fault compensation for everyone. In other words, there will not be the necessity for lawyers to prove that there has been an injury or there has been negligence. Everybody will get compensated. The compensation will be reasonable and it won't be related to a person's wealth. So I hope that that answers the remaining questions. Thank you, Chair.
You have explained yourselves. I'm sure the members have understood where Public Health Association of South Africa comes from, and we will read your documents. Fortunately, the members of the National Department of Health are here and they were listening, and at the time we need them to respond to some of the issues that you are raising as well, listening at the Public Committee. They will do so. We thank you very much that you were able to respond to our invitation, and we are now releasing you. Have a good day. Thanks.